Welcome back to another episode of TimeOut with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode. Welcome back to another episode of Time Out with the Sports Doctor podcast, and you are in for a special treat today. We have Dr. Brook Choulet, who is a board-certified psychiatrist, also known as the performance psychiatrist, and she has taken time out of her busy schedule to book you an appointment today. So this is literally your own one-on-one coaching session with her before she gets back to her other clients. So Dr. Brook, thank you for making time. Thank you for sharing your wealth and knowledge with us today.
Thank you for having me. And I love seeing the physical and mental side of sports medicine coming together here between you as orthopedic surgery and me in the sports and performance psychiatry realm. It's always so fun.
Absolutely. So first, let's talk about your background. So we said you're a board certified psychiatrist. Also, you have the certifications to deal with athletes from a performance standpoint. And that's not something that necessarily existed. It sounds like you helped create that, correct?
Yes. So, yeah, like you mentioned, it wasn't as heavily standardized or regulated like sports medicine or sport and performance psychology. These specialties have been around for a while. And what me and some other psychiatrists were noticing in the community is that someone might see one athlete and call themselves a sports psychiatrist, or someone might like sports and call themselves a sports psychiatrist. And there was no standard to that certification. And so me and 6 other psychiatrists created the American Board of Sports and Performance Psychiatry last year, which is a nonprofit organization that solely seeks to credential and certify psychiatrists that meet a certain criteria.
Excellent, excellent. And you practice not only in Arizona, but also in California. So tell us about your practice model and how you got into that.
Sure. So when I finished medical school, I did a 6-year BAMD program in Kansas City, Missouri, and I matched out here in Phoenix, and my whole family was in San Diego. So I was devastated at the time that I was not going home. So I came out to Phoenix and general psychiatry, met my husband at the hospital who's in internal medicine. We ended up putting down roots here, and I did my child fellowship here. And during child fellowship, I really figured out that I did not want to be hospital employed. And I can say that because my husband's happily hospital employed, but I really wanted to start my own group practice. And so during my residency and fellowship, I really started to build that. And so I started the group practice before I finished residency and fellowship, and I grew it to 10 clinicians over the course of the last 3 years. And so I was able to transition out of fellowship into my own practice. It is a concierge practice, so all of our psychiatrists and psychologists give our patients our direct cell phone number. They could contact us. And I really would travel on the road with the Suns and the Mercury for over 2 seasons, providing consulting psychiatry services to their team. So the concierge model really just allowed me to practice the way I wanted to and give patients the time and the attention that they needed.
So tell us about how you envision this practice, because I'd imagine during the formal training of psychiatry, you're covering all different types of pathologies, not necessarily treating high-level athletes or high-level professionals. What made you want to kind of specialize in this? And then how did you create that?
Yeah, so I never really knew I would go down the sports route until I opened the concierge practice and realized that I was getting professional athletes requesting home services for their kids so that the parent that's very well known doesn't have to sit in the waiting room. And so very slowly I developed this clientele that was professional athletes and their families, as well as other doctors, lawyers in the area, other high-level professionals. And I really started to put together that all of these individuals had very similar issues in very different settings. So their issues and the struggles that they were having were so overlapping, but just one was on the basketball court and one was in a boardroom. So that's kind of where I started to really dive into this population specialty.
Sure. And talk about your background. Are you an athlete or? What was
I'm
the
not.
connection with? Okay.
I'm not. So I really enjoy watching sports. I grew up always watching basketball with my dad and watching football. I'll call myself like a wannabe athlete. I was in high level tennis in middle school and high school, but then going to the 6 year accelerated BAMD program, I had no time to do anything but study. So I didn't really have that opportunity. So I was not a collegiate athlete or anything. I was forced to do college in about 2 years. So my college experience looked different than most.
Yeah, so you've definitely blazed your own trail from the beginning with, like you said, the BSMD program, which is serious. I mean, you're talking what, 20 plus hours each semester plus
Yeah.
summers to get through the undergrad curriculum and then start your junior year. Essentially, you're a medical student. So we had a couple of people in my class like that, and I was always in awe of how they were able to push through that. But I think this is really important for young doctors because I was speaking to a young physician just yesterday about, creating a sports medicine type practice.
Mhm.
And, you always think, okay, how am I going to find a job, right?
Right.
How am I going to do exactly what I want to do? And I said, well, you might have to create a job, and that's exactly what you did. So just kind of talk about the mentality of that.
Yeah, I think having a determination is really important that you're like, I'm not going to do X, Y, and Z. So I just have to figure out how to make it work. And people often ask me what I regret the most starting this business or what challenge was the hardest. And I actually think that challenge is what made me have to put my foot on the gas and accelerate. And I remember it, I was 26 years old and I walked into this office I'm sitting in today and I'm like, I think I want to sign this office lease. And it's a 2,800 square foot, 8 office space. And then my husband, God love him, so supportive. He was like, are you sure you want to do this? This is a really big step. And I'm like, yeah, they're going to make me sign a personal guarantee, but I think I can do it. And I signed it. I was 26 in fellowship. I had no one else working for me. I didn't even have a patient myself. And I was like, I have to make this work because in a month from move in, I'm going to have this giant rent bill to pay and I have to figure out how to make this work. And so I almost feel like while that was my biggest headache, it also forced me to figure out really quickly how to make this work.
Sure. So you bet on yourself, which I think is very
Mhm.
important. And betting on yourself is not easy when you don't have experience with what you're going into. So I think probably I'm going to say that you had past experiences of being successful. And that's why you could say, all right, I can do this versus if you don't have the mindset of I
Mhm.
can achieve, greatness on my own, or, many times as physicians, we always need to take another class, another course before we're ready to do something. So I think that speaks a lot to you being able to go out on your own and betting on yourself.
Thank you. And I think it's important that all of us continue to be lifelong learners. I think the people that I see, even in my office as patients, that struggle the most are the ones that are so stuck in their ways that they're not looking to learn and develop and be flexible and adaptable. And I think that those are traits that are really important because, as I'm sure you can attest, we don't learn business in medical school. We're just sent out of training to go be hospital employed and do the things we're supposed to do, and no one ever taught us how to run businesses. And so for me, it's a constant road of being flexible and adaptable and a lifelong learner.
And what obstacles did you have to overcome, or maybe mental blocks that you had to overcome to be able to go down this road that you're doing now?
I think the imposter syndrome is really big. You come out of training and you know logically that you are trained to do what you're doing in your specialty and that you've had the amount of hours to feel confident in your skills. But then coming out and having people say, like, oh, are you sure you can charge those rates coming out of training? Or you're still in training. How can you be charging private practice rates? And really learning to silence the noise around you is important to be able to continue on the path that you believe in. And what I tell my patients is to almost envision that they're in a bubble and that whether someone gives you a compliment or an insult, neither permeate that bubble, so neither impact your level of self-worth. And I think that's really important. And I have these teenage girls I see that are like, wait a minute, I can't accept a compliment. What am I supposed to do with that? And I think it just goes to show that your own level of self-worth should be defined from within rather than kind of watered by the people around you.
So that was teaching point number one. So if you miss that, put yourself in a bubble, right? So I think that's so important, because another way of saying it is don't get too high or don't get too low, because the same people that are praising you, and you will learn this as you get into your career, or you're dealing with an employer or with a hospital system or whatever it may be, especially dealing with patients. They'll pat you on the back one day. This is my doctor, he is great. And then the next day you're terrible. So if you're on that roller coaster with them through this emotions, it's going to be hard to be able to do that, especially when you're dealing with sick patients the same way. You know, one day you feel like a savior when you heal somebody, and then the next day someone dies and you go down in that hole, it's hard to stay level. So I think that's very important. I
Right.
mean,
And I'm
knowing
sure,
your own self-worth is very important.
yeah, and I'm sure you see it with athletes too that you treat as like the coaching staff or other players on your team, or social media is like you had a great game and they're like, oh my God, you're so amazing. And they're riding on this high, and then they miss one shot and now their family's on them, their friends are on them, coaches. And if you let those ups and downs like impact your level of self-worth and who you are, it just sets you up to never feel that stability.
So, you mentioned athletes. So let's transition to that. When we're talking about performance psychiatry, let's talk about some of the basic tenets or some of the basic principles that you preach or that you teach to your clients.
Sure. Yeah. So I coined the term performance psychiatry because sports psychiatries existed, but it didn't encapsulate the CEOs or the executives or the professionals I see. And really, I saw it as no, this is performance psychiatry. We're taking high functioning, high achieving people who are maybe having performance anxiety, the imposter syndrome, feeling like they're performing but not at their best, and looking at ways to enhance everything in their life. So I'm not the typical psychiatrist that is doing, like I still take all of the history and whatnot, but I want to get an audit of that person's life. And so what are they spending their time doing that they hate? What's taking up a lot of time? What are the inefficiencies in your day-to-day life, whether it be at home or at work? And really diving into each one of those things in a nitty-gritty fashion so that you could look at your life 6 months from now and be like, whoa, I have way more control over my day-to-day, which is helping my mindset and effectively making me perform better in all realms of my life.
Yeah, I like that. And one thing I talk about on the podcast is time is a very valuable asset. And I might say even your most valuable asset,
Yeah.
but I think you might disagree and say your mental health is your most valuable asset. So kind of talk about that.
Yeah, I agree. I think as we all get older, our time and our health are our most valuable assets. And so knowing that you only have so much awake time in a day, how can you use it most efficiently and use it for things that you enjoy? Personal example was when I first opened my business, I was spending so many hours on these one-on-one networking meetings. And I'm like, man, this week alone, I may have spent 5, 7, 8 hours just meeting with people individually. And I am always looking at ways to be more efficient and to optimize things. So I created a professional networking group in the area of doctors and lawyers. And anyone that wants a one on one meeting time, they get invited to our next event. And I can concentrate all of my kind of one on one meetings in a 3 hour period once a month. And so I'm even in my own life looking at ways to get more time back and still do the things that bring me joy, which is building community and meeting other people.
Sure. So we'll definitely want to share that information with the audience so they can connect with you or join one of these groups if they feel entitled to do that or feel that led to do that.
Yeah, that would be great.
And what are some of the common traits that you see in high performers, whether it's CEOs, physicians, lawyers,
Mhm.
whoever, athletes? What are some of the common traits that you see that they have challenges with
Mhm.
dealing with their success or dealing with trying to achieve whatever success they want to achieve for themselves? As healthcare providers, we spend a large portion of our lives focused on our training as well as taking care of other individuals. But I'm calling a timeout because life can change in an instant. We know it's difficult to fathom that a sudden illness, injury, or death could put you and your family in a devastating financial situation. But that's where Dr. Stephanie Pearson and her unique team of advisors at Pearson Ravitz come into play. They focus on empowering physicians like yourself to protect your most valuable asset, your income, and life's most important people, your family. So go to pearsonravitz.com to make sure that you are protected today.
Yeah, two things come to mind. One is that they feel like their schedules run them and that they're not in charge of their schedules. And I saw this great meme one time that was like, I've never worked so hard to work 80 hours a week so I don't have to work 40. And I think that really explains the life of an entrepreneur or professional who is really spending all of their time and energy building something and even working more than a person with a full-time employed job. And I think that looking at those issues, there's this constant pressure felt from family that they're not present enough, or friends that they're not good at keeping relationships reciprocal, not to mention work that they feel like they're drowning in. And so I really like to talk to them about having theme days where it's like Monday, Wednesday, Friday, maybe you work on a certain company or project, and then Tuesday, Thursday, it's different. I take Thursdays as passion days or administrative days where I'm working on things building towards my future. So, I really see that in a lot of professionals. And then I think the other big thing is expectations and boundaries. And I think in our society today, people feel like they're being mean by setting boundaries, whereas it's really just a boundary. It's not being mean, and they're just trying to do what's best for them. I see that a lot with athletes too, of their salaries are public and they have several people on their payroll, oftentimes family and friends, and feeling this constant pressure that I need to provide and do more for them.
Now, when we think about like a concierge practice like yours, many times psychotherapy or counseling kind of come to mind, but you're a psychiatrist, and the difference between a psychiatrist and a psychologist is that you can prescribe medicine. What role does medication play in your practice as well?
It's a really good question, and it really depends on the person. So I see some athletes that have mild anxiety or mild depression, and we're able to do a lot of therapy together and keep them off medication because obviously, in an athlete's mind, their number one worry is, will this medication impact my performance? Or is this medication a prohibited substance? So oftentimes for mild cases, we're able to do therapy and keep them off medication. But in moderate to severe cases of depression or anxiety, or in cases of untreated ADHD, medication can be life changing. And so we really have a thorough risk benefit discussion of how the medication could work in conjunction with psychotherapy that we're already doing together, and that it's not a lifelong sentence. It's not something they have to be on forever.
And one thing with sports medicine and sports psychiatry is there's always pressure on the athletes or the
Mhm.
treating providers, right? So I
Yeah.
always joke because somebody comes to me with an injury before we even really discuss treatment. The athlete, the parent, the agent wants to know what's their return to play date, right? So
Hmm.
I can only imagine, we have an injury like a knee injury, a meniscus tear, ACL tear. We have a lot more data to say, okay, 4 to 6 weeks, 6 to 9 months. But when you're dealing with psychiatric illnesses, it's hard to put them on a timeline. So are you under pressure in that way, and how do you handle that?
Yeah, it's a really good question, and really there's two different types of return to play I look at. One is, like you said, athlete has an ACL injury or a physical injury. Well, not only do they need that physical clearance to return to play, but in my mind, there should also be like a mental health clearance to return to play, because the number one psychological factor of injury is the fear of re-injury, right? And so an athlete gets
Yeah.
injured and now they're fearing, will I be able to get back to where I was before? Am I going to get re-injured? And so in my mind, when there's even a physical injury, when I was with the Suns, I was writing up a protocol of, depending on the length of timeout and length of rehab, what this protocol would look like in terms of the mental return to play aspects that would correspond with physical. And then, like you mentioned, if someone's out for a mental health related reason, that they should have an assessment by the psychiatrist upon departure from play, so that there's a baseline and then assessment upon return to play to clear that player to come back.
Yeah. And with athletes, many times there's, a tough guy mentality, right? So just talk about how mental health is not necessarily being tough, or either mental toughness. A lot of people use that term without really understanding what it means, but how being mentally strong is not necessarily being just pushing through all your problems.
Right. And I think that's touching on the difference between even mental health and mental performance. So when I first went into a professional sports organization, I immediately had like these guys and women standoffish and like,
Mhm.
oh, like I don't need you, but it's really nice to meet you. And I know how to get a hold of you if I need you. So my role is education. Like, hey, I'm not here for just when like stuff gets bad, right? I'm not here for a crisis. I want to help you from where you are today get even better. And I think that's where there's that spectrum of mental health to mental performance of now how can we take where you are today if in my mind there's like the green yellow red zone of mental health spectrum of health, and if even if you're in the green zone, how can we still work together to even elevate your performance further? So I think that the I see my role primarily as just education when I first get into a team environment.
Yeah, I agree. And I think it's very important to normalize mental health education or normalize mental health
Mhm.
treatment, because we're all suffering or we're all dealing with something, because
Yeah.
mental health is a spectrum, right? Between
Mhm.
normal, which good luck with that, to mental
Yeah.
ill. But we're all on a journey. And
Mhm.
the sooner you intervene, similar with me, if you come into me earlier with
Right.
a pathology, we might be able to do non-surgical treatment. But if you come
Right.
late or present late in the disease process, surgery might be the only answer. So I'm sure
Mhm.
it's pretty similar in your treatment process as well.
Yeah, exactly, and I think that's where we can do a better job in the mental health space, kinda educating on the effects of, being preventative in our approach rather than just being a treatment or crisis intervention.
Yeah. So when you're dealing with, you mentioned not only dealing with high level athletes or
Mhm.
high level performers, but also dealing with families. So how do you go about counseling professionals or athletes about getting their families involved in the treatment as well?
Yeah, I look at the whole player ecosystem. You imagine like the player in the middle, and then there's athletic trainer and PT and sports medicine, orthopedic surgery, family, friends, significant other who may not be family yet, but not married into the family, and the agent. And you have this whole ecosystem that's constantly hovering around the player. And how can you work with them, or is it beneficial to work with them? Because sometimes the player is really private, and maybe just knowing that it's the one-on-one, just him or her and myself, and not having other people involved is their only safe space. And I've had a player say that to me, like, this session is the only safe place I feel like I have because everyone else in my ecosystem wants something from me.
Wow.
And there's that constant pressure of, are you going to buy this for this family member, or put this friend on payroll, or get engaged to this person. It's just constant. And so I love being able to provide that space of you can know 100% walking into my door that this is for you. It's not for someone else to get something from you.
Yeah, and just kind of speak a little bit more about that patient physician relationship or patient athlete relationship,
Yeah.
because it's a trust thing, because they can come in and only be vulnerable to you if they know that what they tell you will stay
Mhm.
in this room, not hit the news, not TMZ, not
Right.
be on ESPN and affect their next contract. So just kind of talk about how patient relationships, it still
Yeah.
applies in your field.
It does, and I that's what I explain to them, just like there is patient-physician confidentiality with a patient that comes in my office, it's the same with them. They're not different. They're not having different privileges than someone else, and so I really just try to provide that education, but I don't blame them for being skeptical because oftentimes by the time they get to my office and they're in a professional organization, they've been burned so many times, whether it be family, friends, agents, teams. If you think like even just think about sports teams, you're not safe even if you have a contract. You could be traded. They are living in a state of distrust, and so I don't blame them for being skeptical of people's intentions or ability to trust them. I really don't.
Sure. So we know that we're not your last patient for the day. So On Time Out with the Sports Doctor, this is your final timeout. So you've shared a lot of gems about performance and anxiety and imposter syndrome, things of that nature. So let's just kind of sum it up to what's the relationship between mental health and your peak performance, no matter if you are a middle school athlete, a coach, a teacher, a parent, or a professional athlete or a physician.
Yeah, and I think the best way to sum it up is that if you are not mentally healthy, you're not going to perform at your best. And so taking the time to work on your own mental health and well-being will in turn help you perform better, whether that's on a quarter field, at work, in school, at home, managing your family. All of those things are impacted by how you're feeling as a person inside. And so the more mentally healthy you can be, the better you can show up for everyone around you.
Absolutely. And for those who want to connect with you, tell them we'll include your information in the show notes, but tell them where they can follow you or how they can reach out to you to set up an appointment or become a part of the mental health performance networking groups.
Sure. Yeah, you can reach me on Instagram at Brook Choulet MD or through my website, brookchouletmd.com. I have my cell phone number and personal email address listed on there. So I look forward to hearing from you in any way.
And that's the part of the concierge medicine. She has a cell phone number listed. So,
Thank you for having me on today. This was great.
Absolutely. Thank you for reaching out. And how did you find out about the podcast?
I think I found out about it through Instagram.
Okay. Perfect.
Yeah.
Well, I really appreciate
working.
you. Yeah, I appreciate you reaching out. And this was great. As soon as I saw your profile, I was like, we definitely have to connect because I know there's a lot of synergy there.
Yeah. Thanks again.
Absolutely.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Time out with the sports doctor. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine